blunders and mistakes. And so it started when my mom died of sudden cardiac death about 4 months after her two-vessel coronary angioplasty. Rena, that's what I was doing at the time. I was doing angioplasty and atherectomy and stent implantation in another city. And then I get the call, my mom died uh, of the disease I was taking care of. So, but it drove home to me. Here I am in the hospital laboratory, fixing people's arteries, opening them up. But there are people dying in the ambulance or found dead in their kitchen or bedroom. So heart disease is not something that always gives you warning. So it became clear taking care of this disease in a laboratory was as woefully inadequate. So back then, this is 35, maybe 37 years now, but a long time ago, I asked, what could I have done to tell my mom, hey, mom, 2 years from now, 5 years now, whatever, bad things going to happen. What can we do now to prevent it? Well, back then, this is still largely true. It was a CT heart scan that generated a coronary calcium score. My friend Dr. John Rumberger developed this science when he was at Mayo Clinic, and he showed that calcium is a dipstick for the amount of total atherosclerotic plaque. And then Dr. Arthur Agatston of South Beach Diet, that guy, he developed a scoring system. So this all took place over the last 35 years. And you scanned people left and right. And it became clear when we did lipoprotein testing, it was the small LDL particle that's the driver, caused by wheat grains and sugars, amplified by insulin resistance, driven by phenomena such as poor diet, lack of vitamin D, lack of magnesium, lack of omega-3 fatty acids, and the endotoxemia of SIBO. So we address all those things, and your listeners, when they do this, it's a little complicated perhaps at first, but once you get it, all we're doing is mimicking the lifestyle of humans before all this mess started, and you're given magnificent control over coronary disease. So it's very common for us to have regression or reversal of coronary disease. We don't even have to talk about stents and bypass surgery and sudden cardiac death.